Record on. Good evening, everyone. This is IMG Research Academy, now Global Research Initiative. We'll be having a talk today on what is research. There's a lot of people who have this. I want to do research, but I don't even know where to start from. I don't know what to do, how to write. So we're going to go into that, demystify it. My co-host today is Dr. Endurance Ibaeka. He's a cardiologist in training. My name is Dr. Okobi Edwards, and we have lots of people listening to us from all over the world who are interested in figuring out this thing called research publication. Many of us are either in our PhD process or trying to get into residency, or actually residents in the US or in Canada. And we're going to be recording this and posting it on our social media page for posterity's sake. We also require everyone on this meeting to put their videos on, mute yourself wherever you are, sending your questions. It's going to be participatory style. I'll talk a little, Endurance will talk a little, and then we go from there. Endurance. So we're going to act like we're having a conversation because we've seen that that formal style of teaching where we drop slide and one person reads. Sometimes it doesn't even go. Flow with some people. And behind the scene, we've taken some questions on what are your concerns about research, and we've heard what a lot of people have said. What would you say research is?
Well, thank you very much for that question. Research is just asking a question and finding a systematic way to approach the question that you've asked. So I'm asking a question and I'm trying to answer my question. That is research. That's basically what it is. At the core of it, that's what it is. And so that's just to answer your question, right? I'm asking a question and I'm trying to find a systematic approach to answer my question. That's what research is. And the problem that most people have is, where do I start from? Now, because most of us here are just physicians, I would say the easiest and fast way to start research, get your hands, acquainted with what research takes, is to do a case report. What is a case report? A case report is reporting a rare case that is publishable. And the bulk of your publication in case report is just writing what happened. Patient came, we saw X, we did Y, and Z happened. That's it. Case report. So if you wanted to find out.
Yeah, go ahead. But before we get to case report, one of the misconceptions hold your thought. One of the misconceptions I've seen with a lot of people is that people think that research must be one mRNA, DNA, looking into a microscope, trying to figure out data, one big data, harvesting it, getting it from somewhere, fixing it, getting p-value, getting curves, getting relationship. Is that what it is?
Well, yes and no. Mostly no. So in case reports, the idea is you can approach it in various ways. You can approach if the patient is coming and has a condition that is very rare, or if your treatment modality for that patient is new or is unheard of. For example, there's a patient that I've seen that had normal problem like heart failure. But why did the patient have heart failure? The patient had a procedure done where they had to they put a patch around the heart. They put an artificial patch like pericardial patch. And that procedure has never been done ever in the world before. So we're not talking about the patient itself, we're talking about the procedure. So it could be a rare presentation, it could be a rare intervention, it could be a rare drug adverse event, it could be something that happened earlier than supposed to. For example, if we know that Dressler syndrome, that's pericarditis of the heart, happens 6 weeks after someone has heart attack. But what if it happens, 4 days within that time? Would you call it Dressler syndrome? Would you not call it Dressler syndrome? Would you say it's pericarditis, but it's not autoimmune? So you could shape the question, you could ask the question from an interesting point of view. It all depends on what angle that you are trying to ask this question. And then it becomes interesting, the way you package it. But so that's that. But I think the pressing question that most people have is how, if I don't have a case report, how do I ask a question? And that brings me to my next step. I think we'll make this very interactive, and I will find anybody who is on the line who can share their screen, and let us try and talk about ways to ask questions. So is there anybody, anyone in the audience who wants to share their screen, and let's go and start looking at practical ways, because I could break them down, I know, like a whole breaking down, but I would want somebody that I would interact, and I'll tell you ways that you could ask some questions. Okay, let's have anybody who volunteers to share the screen, and let's see.
While we're waiting for someone to volunteer, and Endurance will continue on that same thought process. Let's look at other very easy way, because I want to say there are so many other easy ways to also do what they call research. There's a literature review, there is simple editorial, there is and the other ones that prospective design and the rest. Let's run through them, just a very brief overview of what they are. Now, what we're telling everyone is, if you want to start easy. Start with the ones that have very low threshold to start, because if you make success, it will encourage you, it will serve as a positive feedback to become successful in the next, and every day you keep improving. Dr. Endurance, there are other types of research that perhaps you could, in a very simple way, simplistic way, just say what they are, things that are considered as research.
Okay, so the simplest form is case report, which is talking about one case. After that, you have case series, which talks about more than a case, just about a few cases, about 2 to 10 cases, so case series. Now, outside of that, you can also have a literature review. And what that means is you are looking at its particular topic, and you are trying to summarize the most recent development in that field. Now, under literature review, there are different types. There is state-of-the-art review, there's just comprehensive review, there's systematic review and meta-analysis. But for the purpose of not confusing everybody, we will call it literature review. And what you are doing is, I want to talk about hypertension, for example, and I am only interested in looking at the development of hypertension in the last 5 years. I'm not interested in looking at what happened in 1930. So I just want to look at hypertension in the last 5 years and talk about all the latest changes. For those of you who don't know, there is no new medication. Hypertension has not had a new medication since almost 20 years. The first new hypertensive medication was just tried in a clinical trial. I think it's called lorundrostat. So that's the first medication that has been produced in the last 20 years. So you can say, oh, now let's look at, we're comparing the last 5 years in the development of hypertension medications in that space. What has happened in the last 5 years? Or what has stopped the development of antihypertensives for the last 15 years? Why haven't there been any new antihypertensives? So you will go and look at all the literature. You select high yield literature and go through them. There may be 20, there may be 30. You'll summarize, you take a look at every 20 articles produced in the last 20 years, you summarize them, and then you, in your words, write them, convert them into a literature review. Now, it sounds very simple, but this is a little bit esoteric. I would love for us to go through it one, just like step after the other. But the first thing is to have an outline. you'll read about 5 guidelines of hypertension. You read 5 guidelines, American guidelines, European guideline, and maybe 9 African guideline. And then with that, because you've now read a huge volume of knowledge from those 3, you will establish those 3 guidelines as your pillar to create your formats. And then you'll now establish an outline. An outline will be how you want your paper to flow, from introduction to methodology to subsets: hypertension before COVID, hypertension after COVID, hypertension in the young, hypertension by race, hypertension by sex, and then limitations, conclusions. You have an outline, and then you will use your 20 papers that you've gotten from your review.
Let me hold your thoughts there. Let me hold your thought there in an outline. So in summary, you've said, let's say there are different types of research that we've discussed now. We're going to use a practical example by someone sharing his video or his screen, and then you mention outline. Someone that hasn't done it before will be like, what is outline? Is there like a standard outline? Is there a fixed outline? Who's responsible for this outline? Do I generate this outline myself? Or is there one professor in Harvard that have to approve this outline and create it?
Yeah,
What is an outline?
There's no standard outline, actually. So, remember when I said you look at guidelines, like at least 3 or 4 or 5, what you are trying to establish, you are trying to look at the 5 most comprehensive evidence in that space, and usually they are guidelines. When you've gone through 5 of them, you will be able to understand headlines that you want to include as outlines. So just by going through that 5 pillars of those 5 literature, you now have an idea of what's important, what needs more, what needs more attention.
So more or less, what it is rephrasing your word, is you're trying to tell a story. So you're trying to build the basic tenets of how you want to tell this story and arrange them until you get to a conclusion. So you're trying to create a story of your research process, what you found, the introduction, the methods, then you discuss the whole thing. What subheadings are you going to discuss and how is it going to flow? And then eventually, what did we find? I don't know if I'm correct.
Yes, you nailed it. Yeah, that's correct.
Go ahead.
So it's a literature review. You have 30 references or 20 references, but you have 5 that will serve as the pillars. Okay, understand that concept. 5 will serve as the pillars, and those 5 are usually guidelines that would be the pillars for how you structure your research, your review. Now that you've structured it, you now go back to your 30 research papers that you've kept on the side, and you pick them one by one, and then you find after summarizing them, you find which of them best fit under what outlines. Okay, that is a way to summarize that.
Hold your thought, because you mentioned 30 papers, references. I believe there's someone here, because I'm trying to bring this down to a grade 9 conversation. I know you're a cardiologist, you've written tons of paper. I'm a family physician, I've written tons of paper. Somebody may not even know what is reference. How did I decide to get 30? Why not 5? Why not 8 references? Why not 50 references? I don't know if there's anybody here who is resonating with these questions. And then feel free to ask your questions, because we're listening critically. We want to really break these things down into very tiny pieces so everybody can understand.
Okay, that's a good, fantastic. So if you have a question, and you could raise your hand, or just drop the questions in the chat. Because my goal is to have you be able to understand how you can self-direct yourself, school yourself, and be able to take the initiative to write this paper. Okay, so what is reference? References are the evidence that you are pulling from to write your own paper. What the existing literature, before you talk about
Sources.
hypertension,
Right.
other people have written about hypertension. What reference is you are trying to make a statement off the back of the people before you, the scientists before you, the previous publications. So I will say, for example, hypertension is a deadly killer as outlined by the guidelines of American Society of Cardiology and the guidelines of European Society. So what I'm doing now is I am making a statement that hypertension is a killer, and I'm saying that the reason I'm able to confidently say this is because it is supported by the guidelines of the hypertension in the US and guidelines in Europe. So so that is what your reference is.
Hold your
How,
thoughts, endurance.
how do you get that reference?
Hold your thought before you get to that reference. So there's a question that someone asked, probably the person is joining us, said the first 5 papers. Let me just bring you up to speed. Endurance used 5 papers as example. There are no 5 papers anywhere. He was trying to say, let's say, he said, let's say you want to create a topic to review. He was talking about literature review. Initially started about case report. I cut him short and I asked him about what other papers, and I gave an example of literature review. And I said, let's say you want to review guideline on hypertension, or why, let's say you have eventually come up to the point to review guideline on hypertension, or why hypertension kills people, or relationship between hypertension and something. Let's say you've come to that point. We'll discuss how do you get to that point. Let's say you come to that point and then there are 5 papers that you want to review. That's where those 5 papers, that's where the number 5 came in. It could literally be, or 5 guidelines that you want to review. That's where those 5 guidelines, the 5 papers that were written on those guidelines were. It could literally be 5 or 10 or 3 or 2. I don't know if I clarified it, Dr. Endurance, correct?
Yeah, so I like to use guidelines because they are more comprehensive, and of course they are the guidelines, so it's better to start from the guidelines. What you need to do is when you're writing a research review, you need to have what they call pillars. It can be the guidelines, but if that area doesn't have a guideline, you can find papers that are state-of-the-art review. State-of-the-art reviews are also very comprehensive. They mostly talk about recent happenings in that area. So you can use state-of-the-art reviews and read them and use them as an idea to get the idea of how you want to structure your paper. But when it comes to writing your paper, you would need the entire references. But it is very important to have an outline, because the problem that most people have is when you don't have an outline, you just struggle with when to write, when to stop, what to write, what next to write. So the first thing you want to do is pick a topic and find a system to get you that outline. But more importantly is picking the topic. Most people have that trouble of picking the topic. And that is actually what I want to talk about very, very deeply about today. And I'm still waiting for that person to share the screen. I don't see anybody sharing their screen with me.
So while we're waiting for pick a topic, someone asked a question on national inpatient data. Before we, be everywhere, we're following a very little sequence. So it could be narrative and easy for people to understand. We started with what is research. We discussed that, went into types of research, which we overviewed some very brief ones. We talked about case report, talked about literature review. There are a couple of other ones, because this is like a dual conversation thing. A couple of other ones like prospective studies, like interventional studies, like ecological studies, like also there's also primary research and secondary research, primary data and secondary data. We need someone to volunteer, because this is just filling the space while we're waiting for. Let's say Dr. Buki, do you mind volunteering, sharing your screen, or anybody? And feel free. If there's anything in your screen that you don't want to share, you could just, close all your screen. Let's say you have your private things there.
What I want to do right now is find somebody who wants to do research, but is having trouble with coming up with a research question.
Right.
We want to practically find that research question today, like on the spot. That's what I want to try to do.
So let me use, because some people might be video shy, but in this forum, we don't want anybody to be video shy. Again, this is IMG Research Academy. In IMG Research Academy, we talk all things research. There's no right or wrong questions. There's no right or wrong suggestion. We're all here. And Ibrahim. Okay, Dr. Ibrahim. Good. So Dr. Ibrahim, I'll add you to Spotlight, and also make you co-host so that you can share and unshare. Make you co-host, and then we go from there. So while we're waiting for Dr. Ibrahim to share,
I have a couple of questions for Dr. Ibrahim. Thank you very much for accepting to share. What are your interests?
My chief, thank you so much for your time and efforts. I'm a rising PGY1 psychiatry resident, as you are most likely aware. So, and the third too is aware. So my interests are in psychiatry related topics, and also, of course, there are topics that overlap between IM and psychiatry, internal medicine and psychiatry. Almost any specialty can actually overlap with psychiatry,
Yes.
So you can say depression, the prevalence of depression post MI,
Okay.
That's related to your feed, that kind of stuff.
Let's share your screen. Share your screen and let us try and find questions.
Okay.
There is a part that I want to briefly talk about quickly in 2 seconds about because I see people make this mistake all the time. Coming up with your research topic that endurance want to address. There are 2 things in this forum. 1, you're applying for a specialty. 2, you want to figure out and solve a problem. Both of them sometimes can overlap. Sometimes they run different. They run in parallel form. For example, Endurance was lucky to have his research interests overlap with his direction. Now, if you're looking at maternal mortality, you so much like maternal mortality and what drives it low. That's what drives your passion. But you're applying for psychiatry. You see that maternal mortality and psychiatry, they don't blend. It's not going to support your application. So, because I see oftentimes when we ask people, they say, I'm interested. What we are trying to let people know is to narrow your interests first to something that will get you to where Ibrahim is. Then from there, you can now pick a niche. For me, I love lifestyle a lot. If you notice, most of my great papers are on lifestyle. But I first narrowed my research because your research is going to help your application to get to family medicine, to get to cardiology. Before you, like Endurance is going into interventional cardiology or heart failure. Now he's going to narrow most of his, the topics in his head is now going to focus on that niche. So if you are joining us and don't go ahead, Ibrahim.
Yes, thank you.
Yeah, once I see your screen, I'm going to stop talking. So if you're picking a topic in mind, just know that please pick a topic that will help your career growth. Because if you do all the research in the world and you're not able to get into residency or become out of spotlight, you can share your screen, Miriam, or become who you are. It's also going to be discouraging, very discouraging. Let's say Dr. Saloko, for example, likes interventional psychiatry. And then, but deep down in her, she really wants to solve why children cry. Why you see a share screen, or what makes a baby sleep, or what doesn't make a baby sleep.
Yeah, I'm sharing my screen now.
Good, Dr. Niran, speak up from there. So that's how to get to, first of all, narrow your interest down to what is going to help your course. And then you now begin to pick a topic. Dr. Niran,
okay, so we talked about, you said depression and myocardial infarction, right?
Yes, just as an example, it does not necessarily mean that's my interest, but of course, generally for now, the whole of psychiatry, any psychiatry related topic is my interest.
Again, Ibrahim, I'll stop you there because the whole of psychiatry cannot be your interest, right?
No, I mean for now, I will still narrow down. As
Okay,
as
no,
an
let's
intern
go ahead.
now.
Go ahead, Endurance.
Yes.
Because that's what makes it very difficult for people to come up with topics. This
Yeah.
is too broad. The whole of
In
the world
psychiatry,
cannot
we
be.
can have I have interest in like addiction, psychotherapy, interventional stuff like that.
Okay, no problem, Dr. Buki. You can also share your screen.
Okay,
Also.
so what you do now is want to talk about myocardial infarction and depression. You can type myocardial infarction in depression, comma, state-of-the-art review. Myocardial infarction in depression, comma, state-of-the-art review.
Again, while they're doing that, this is Global Research
Yeah,
Initiative.
enter. Okay, look for the publication that is the most recent and in one of the most prestigious journals.
Okay. The first one is 2015. This one is 2023.
What journal is that?
2023 should be, let me open it. Reviews in cardiovascular medicine.
Okay, let's go back to the home screen.
This one is 2025.
No, that's MDPI. Go down, scroll down. Okay, so let's go to screening. That's Jack, right? Or no, scroll down, that's nature. So there's Jack, there's nature. Just scroll down. There's Jack, there's nature.
This is Nature.
Okay, let's click on the Jack first. That's a meta-analysis. Okay, so this is the state-of-the-art review. Let's scroll down. Just scroll down. Okay, so what I'm trying to do now, guys, is I have an idea of I want to do something in depression and myocardial infarction, but I'm not sure how to come up with a research question. One way to do it is to go and type that question that you have, myocardial infarction in depression, state-of-the-art review. Or you can do, if you don't find state-of-the-art review, just do guidelines, something like that. And then find the most recent publication that is in that line in a top journal. If it has to be a review, state-of-the-art review or guideline. That is guideline or review, that's better. Then scroll down to the end. You will see a portion where they write gaps in knowledge or future direction. So let's scroll down. Scroll up.
I don't think it's here
Or just do
again.
Control F and do gaps.
You can also see it in recommendation.
There's nothing like that. I think maybe
Yeah.
it should be under
Go
recommendation.
down to the conclusion and
It's right here.
recommendation.
No, stay. Go up, 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 up. Down. Conclusion. Future. Look at it right here. This line, future randomized clinical trial comparing different pharmacologic. Can you see that? Online. Yeah. Put your cursor there, down. Under cardiovascular. No, the next.
So they say, so exactly. So say, while studies of antidepressant treatments so far have focused on measures of depressive symptoms and severities, future studies should evaluate patient-centered outcomes, such as quality of life and functional improvement. Okay, so that's one again. And then two, they said Future randomized clinical trials comparing different pharmacological and non-pharmacological approach may further our understanding of personalized care in these aspects. Then go up again. Let's go to the recommendations. What they say in the recommendations. Bear in mind that right now you are taking notes, right? You're taking notes 1, 2. This may be something that you want to look into, right? Because this happened in 2023. You don't know if there's a new intervention that you can explore as for comparison. Recommendations, they say pharmacotherapy with SSRI or this may be considered as first line in patients with this. So basically, you want to read this recommendation. There will be questions from this recommendation. Can you scroll up a little bit? Let's see if there's other questions that we can. Okay, so let's scroll down. Okay, can you look for in these gaps, where you put gaps, can you type future? Let's see if there's future. Let's do for next. Okay, so there's another future here. You see future studies are needed. So that's number 3, right? Future studies are needed to understand sex differences in the risk of cardiovascular disease among youth with depression or bipolar affective disorder. So what this means is that we have no real understanding of this right now. You can go and check if there's another future that is interesting also.
So, Dr. Endurance, what you're trying to tell the audience is that in many published papers, you could find gaps that you will use
Yes.
as your research topic.
In almost all guidelines, in almost all state-of-the-art reviews, it is loaded with gaps that you don't even have to, you personally don't have to ask questions. You just go there and find the gaps. They will write it out for you, right? But then that is not enough. After looking for these gaps, you have to also verify that it wasn't recently done. Because the last thing you want to do is put in your whole energy into something and then the reviewers will say, oh, this was recently published. So, but that's the first step, is to find where you can get questions easily. What I would encourage you guys to do is, once you go to that review paper, you bring out like a Google Doc and then write the potential questions. Just jot them down. You might have three from them.
Dr. Tosin, you can unmute and ask your question.
Dr. Endurance was saying something. Let me allow him finish that thought, then I'll ask my question.
Sure, go ahead.
Okay, so you'd take notes. You can look for another. So like we've only seen one. We can go to the meta-analysis and look, and then get like 5 questions that we have. And that may be something that we would now look into. But now you've only found the question. It's possible that it was recently published. The next step is to try and see if it's been done or not, so that your research question will be relatively novel, okay? So let's decide that we want to do one thing here. Can we go back to the future? I think we went the future of number 3 or number 2. Go to the last one. They said, let's go back.
Number 3, right?
Yes. So say future studies are needed to understand the sex differences in risk of cardiovascular disease among youth with depression or bipolar affective disorder. So we probably know about adult risk, but we don't know much about the youth risk. So now the next question is, has this been done? Has it been looked at? So let's say our question now is sex differences in risk of cardiovascular disease among the young population with depression and bipolar affective disorder. So let's write that down. Sex differences. So sex differences among young population with sex differences in cardiovascular outcomes, population among the young population with depression and bipolar affective disorder. Now that question, we'll now ask that. So we'll go to PubMed now. Let's go to PubMed. PubMed is a library where you have publications stored there. So you want to go and search this title you have in your head. Has it been done before? So now you go to PubMed. You click in PubMed. You click enter, and then you click their first page, PubMed. And then you type in your question, sex differences in cardiovascular outcomes among young patients, young population with depression and bipolar affective disorder.
Should I put depression and
Depression
or
and
depression
yes.
or?
Yeah, so
Depression
but
or
this is
depression
we're still taking it, gradually, because there are so many other ways to do search.
Oh, there are so many other ways. We're taking them step by step.
We're just taking them
This is
step by
just-
step.
Yeah,
This is just like baby step to do search in PubMed. There's so many advanced ways, but go ahead. Just use this.
Okay. So just use keywords, do sex differences, or do
click on advanced under. Or okay, just to do it easy, just delete all you've said. Click on X.
Oh no. Still use no. Don't click on X yet. Just copy the search sentence and then search for it in another library. Let's go to Google Scholar. Paste it, search. Okay.
So we have a paper on that.
So now we can see that there's sex-specific association, blah, 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 blah. And you go down. Let's look at the first page where let's see, what's the first thing?
Major depressive disorder and bipolar disorder predispose youth to accelerated atherosclerosis and cardiovascular disease.
Okay. But this is not necessarily talking about.
So for those that are joining us, we're still under the initial things. What do I do? How do I form a topic? How do I write? What stage Endurance is trying to discuss now is one of the ways to get a research topic that you're going to write on. And he's been able to use Dr. Ibrahim, who has an interest in psychiatry. They're narrowing down on sex and the relationship between cardiovascular outcome and bipolar disorder. He's gone through the first database to see if he went through how he got that topic, and then he's trying to see if that topic has been done. He has gone through the first database, he's checking the second database. Speak up from there, Dr. Endurance.
Okay, and just so you know, you can do this on your phone. It doesn't have to be like, on your laptop, just on your phone. So we'll scroll down. Now we've looked for it on Google Scholar. The idea here is to see if there is actually an article that has been done on sex difference in cardiovascular outcomes among this young population. And off the bat, I can see that there's a couple of things that probably has been done, but they are not directly comparing the difference in cardiovascular outcomes in this young population. So I can tell right now that it's likely underexplored area. Let's go back up. Let's go back up.
One other thing I will also add, especially in this, some works that have been done, this work may have been done in a different population base. You can also test their hypothesis or replicate it in another population base. Although your work may not be noble, but let's say they did it, the difference in the US population using US data. You can also do it in a Canadian framework if you see that there's nothing like that existing in the Canadian framework. Go ahead, Dr. Garrett.
Okay, so just to keep it, rather straightforward, you search for it on PubMed, you search for it on Google Scholar, and then you get a sense of if it's been done or not. You can also break them down instead of a whole long sentence. You can put them as keywords, sex difference. So let's go back to Google Scholar, and then we can create keywords.
Dr. Salako, you have a question?
Sorry, Google. So someone had a question. Yes, let me have that question first.
Yes. Sorry, my question was going to create a road mind block in my head. Usually when I see, first of all, I want to thank you, Dr. Endurance and Dr. Eddie. You guys are doing marvelous things. I don't know why people are not listening to this because it's something that people pay for, and if you are doing it for free, that's that's a lot. Thank you for your time. So I think this topic, getting topics, is something I've really struggled with. In fact, there's a paper I want to write, but I don't even know what to do about it. But this is really helpful in the sense that, checking below that paper and looking for the future plans or future, what they want to do next. Sometimes I see that some of the future questions they have or the things they plan to do in the future are randomized clinical trials. I'm like, okay, so am I going to do a randomized trial? That's something I cannot do. So that's what I mean by I was creating a mind block in my head already. But I think I went around that and said, okay, it doesn't matter, just check, right? Just check. Don't put that block in your head. Just check and see what has been done.
There's also something I need to add, but that's another level. You yourself as a researcher, because everybody here is a researcher, even though that researchers formally should be a PhD person, but anybody who has an inquisitive mind is a researcher. You may also come up with your own topic. I know the Endurance will address that later. If you have something that really interests you, you could frame it as a topic. Other researchers in the internet, other books in the internet may not have that your thought process because it's unique to you. You're trying to figure out how will Dr. Salako excel? Let's bring it to clinics. What makes bipolar disorder patients come to clinic? It's just a puzzle in your mind. That's your research topic. That's probably another person may not have thought of it ever. Well, you can go and search for it on the internet and say, okay, I have this thought process in my mind. What drives them to be non-compliant? For example, bipolar patient has rational thought process, right? He's not irrational. It's just that he's in extremes of mood, right? So he knows to be compliant, even in his extreme of mood, but many of them, reports have suggested that many of them are not compliant. So why? Even though that they are not like schizophrenia that has loss of insights. The bipolar people, to a reasonable extent, have insight that, I'm swinging, right? But they also have good judgments, most of them, right? So, but they're not compliant. And then in your mind, you're trying to solve this in your clinic, and you're sitting down with your friends or something, thinking of your patient, and you say, why are my patients not compliant? They're not coming to clinic, they're not taking their medication. Okay, you frame a topic around that. Well, I know Endurance is going to discuss that because there's so many ways to frame topics. And it must not be a why topic. It might just be a relationship topic. It might be an outcome study. It might be a primary it could be a preclinical research. For example, you're asking, what affects adipose tissues when people take SGL2? Did they shrink? Did they disappear? When people take all this Ozempic, the fat cells itself, Do they shrink? Do they disappear? Do they dissolve? Now, that's a preclinical trial, right? A preclinical study. So you need to look at, okay, fat cells. How do I get this data? We're going to talk about that. There are people who are actively collecting data. They're collecting samples from people who, before they start Ozempic and after they did Ozempic, what happened to their sodium? What happened to their potassium? What happened to their fat cell? And if you search deep, you will find the pre and the post exposure, especially for those who have done through that clinical trial. Those data are very available. And that's what we do in IMG Research Academy.
Oh, so that's what you mean by the just using data as like an original research, right? Is that an
That's a
original
secondary
research?
research. What I'm discussing now is a secondary research because somebody has already collected the data and published it.
Data.
So I'm
Okay.
now pulling and comparing the pre-Ozempic, the post-Ozempic. What happened to the fat cell? Did it shrink? Have you ever thought of it? Like these guys are losing. I'm losing weight on Ozempic. Really, this thing is really working. SGL2, whatever it is. So what's happening to my fat cell? Is it dissolving? Is it just squishing? Am I metabolizing it? What happened to the vacuum? What happened to the mitochondria? What happened to this? And then you can also do what they call primary research on it and say, okay, let me enroll people who want to take Ozempic. These are the studies that we want to now start doing in this IMG research, the prospective research. Let's see, you want to get Ozempic. Can we get your samples before? And then after 6 weeks, can we get your samples? And then look at it at the microscope and compare both. Now, you now say, okay, how many people do I need for this trial? You just need just one person to compare, just one person. Many papers are not going to accept one person because you need adequate number of N to be able to say this is not by error. That is where the statistics now come in. This observation that I saw in this person is not by error. This observation that I noticed that the fat cells, they squished, they did not disappear, or they disappeared is not by error. You now do the statistical analysis. That's where we now see what they call standard deviation. You now say, is it significant? You now look for p-value. This result, am I confident enough in it? You now look at the confidence interval. This result, is it generally applicable to everybody? Right? We'll now look at variances and say, okay, is it generally applicable to other people? But we'll not get to there. Where Dr. Endurance is. And Endurance, I know I went far away from where you are, but we're just talking about drawing topics and, I deviated a little bit. Pick it up from where you stopped.
Well, I don't think you debated a little bit, though. I think you debated like astronomically far away from where we are. Okay, so we're talking about
research is very beautiful, and the thought process is so beautiful.
Find questions that are waiting for you to find. Now, when you've looked for them in state-of-the-art reviews and guidelines, the next thing is to find if they've been done and how much depth have they been done. This question doesn't look like it's been explored. So your next question is, you've looked for it on PubMed, you've looked for it on Google Scholar. It's less likely that it's been done a lot. So you can now go ahead and say, okay, let me now look into this. That's going to be the next step. How you're going to find the references, the source of your literature that you're going to have as your evidence. But I think I will stop here. I'm going to go to the next step of the next method of finding research questions. I want to let us deal with finding how to conceptualize research, asking research questions before we move on how to start research. Is how do you ask a question? And like Dr. Ed said, it's just about being curious, something's going on, you have to just be cognizant of what's going on. So now we understand how to find those questions in state-of-the-art reviews and guidelines. Now let us find how we can ask questions from clinical trials. So we're still on myocardial infarction and depression. Let us see if we have any recent trial on myocardial infarction and depression. Let's see. So Dr. Ibrahim, we can Google myocardial infarction and depression, randomized clinical trial.
Okay.
Why Dr. Ibrahim is doing his Google search.
You said myocardial
Infarction and depression, randomized clinical trial. Not here, just on Google.
Why Dr. Ibrahim is doing that? Once again, this is
No, instead of state of the art, yes, you say myocardial infarction and depression, randomized clinical trial.
Once again, this is IMG Research Academy. We're doing this research series for people who are interested in clinical research. Please follow our YouTube channel, subscribe to us, and you're going to see tons of our teachings. We've done hands-on holding for people over the years, and we'll continue to do that.
Which one should I click?
Let's say your clinical trials, effects of treating depression and lower.
Yeah, we're looking for a clinical trial that looked at depression in patients with MI.
Okay.
Click on click on that, or copy. First of all, copy that topic: myocardial infarction and depression. Control A, Control C.
Yes.
Control A, Control C.
I've copied it.
Okay, great. Control A, Control C. Okay, click on the first one. Let's see what it is, if it's clinical trial or not.
It's 2002.
Okay.
Let's look for the most recent.
Okay. This is Lance. This one is Lancet 2024.
Okay, click on it.
Let's see, is that a trial?
I don't think so. Let me just open it. This one is size that it looks like a clinical trial. Oh, no,
Okay.
no, not available. Let me open this one. And then this one is a randomized clinical trial, but it's
The
2007.
next one, the other one is also treatment of depression after myocardial infarction. That's a trial. The other one, that one, yeah.
2002.
Okay, let's just use it for example.
I thought we've already opened the one from Lancet. Let's look at the one in Lancet first. Okay. So that's a randomized clinical trial, right? It's an eye care in China. So now the first question is, this happened in China, and in general, because the Chinese population is very homogeneous, we cannot generalize them to the US population or to the African population. So so this is a question, this is a research question that you can instantly just try and replicate using the US population. So that's number 4. So we have, sorry about this.
No worries.
Bye-bye.
We have another way.
So what you can do is, this is a question. So integrating depression and ACS care in low resource hospitals in China. So instead of saying in low resource hospitals in China, it would be in low resource settings in rural America, right? So that's did we lose?
No, you have to minimize this. Yeah.
Okay. So that's question number 3 or 4 or 5. So you can use the same topic, but now you are trying to search for the answer in rural America, because that's low resource parts of America, right? So that's how you can find that question. But let's also go down. Let's scroll down. Let's look at how you can make questions. When you go to the methods, let's go to the methods. And in the methods, look at the exclusion criteria. Just Control F and exclusion.
Let me just take my mouse. Sorry, I want to just use my mouse so that I'll be.
Yeah, just Control F and exclusion. You see exclusion criteria.
Okay. Control F.
Okay. So in this population, the main exclusion criteria was people with bipolar affective disorder, people with schizophrenia, people with psychotic depression, people with active suicidality, people that are alcohol dependent, people that have severe medical comorbidity, and people with life expectancy less than 12 years. What does this tell you? It tells you that a significant amount of people
We're not
who are
included.
were
Yeah.
not included. So when you want to do this research,
You can
you can
include
start
them.
by saying
Right.
bipolar affective disorder patients or depression patients or schizophrenia patients have been historically exempted from previous clinical trials. Hence, we sought to look at the outcomes in this population. So that's topic number 2 or number 5. That 5. So now we have number 5. You go to the exclusion criteria. When they do the trials, they have a set of population that they usually exclude. Your job is to try and include those population and use that as the reason why you want to do that study, because that population also need to have some research done on them. But unfortunately, most trials exclude them, right? So now we're going to include them and I want to study it. And you can be very confident that it's not been relatively studied just because it's hard to have those people in trials, right? Okay, that's one way to, that's one approach. The second approach is sometimes in clinical trials, they may also include gaps in knowledge and future directions, right? So let's look for future or gaps. So future.
Now you had it before. Number 1. Go to number 1. Arrow up.
No, just click up.
Yeah, this one. Yeah. Future research in low resource setting is needed to determine if enhanced psychiatric training for nursing personnel would improve treatment outcomes, or if greater attention to patient selection is needed to benefit from collaborative care intervention.
Okay. Okay. I mean, this is not this is also a question that you can do, but it's like an RCT question, so it's not necessarily important. So one approach is to look at the exclusion criteria and use those population that were excluded as the basis for
One
your
study.
research, right? So like one of our studies that we did, we specifically looked at the population with adult polycystic kidney disease because in most clinical trials, they always exclude that population. So now you want to study this population and it makes a lot of sense. The papers will be very, very happy to receive your research when you submit it. Okay, now within the same clinical trial, let's go back to the trial. Let's look at the we looked at the exclusion criteria, but let's look at the age that's inclusion criteria for the age. And this is mostly for people who are thinking about doing pediatrics.
Just control F, just type inclusion.
There's no inclusion. That's strange.
Control F, type exclusion. Let's see, they excluded children less than 18. Control F, exclusion. Okay.
So participants, scroll down. This is the abstract, right? Just scroll down.
The methodology.
Yes, go to the methodology, and under the methodology, look at.
I think we are under the methodology already.
No, that was
Look at participants. Yeah, result. Look at study participants. Decline to. No, go back up. Look at the participants in the method section, not the results. Okay. So yes, participant, men and women aged 21 to 79, right? So two things happen here. They left out people that are,
Less than 21 years.
they left out people that are less than 21 years, which makes sense because we're talking about myocardial infarction, right?
Right.
They also, and this study is very heterogeneous because you have people that are very young on this spectrum, and they have people that are very old on that spectrum. Now you can argue that we can look at only population that is above 65. We can look at population that are 80 years to 90 years. People who are doing pediatrics, you can look at people who are 15 to 18, but of course not under myocardial infarction. You get the point, right? You find the populations that were excluded, and that may be a very important way to look at it. For example, in most cardiovascular, there are some trials that they excluded patients above 65 years. You can go back and say, we're going to study the population that are 65 and older, right? So that you can now develop a research question specifically for that population. Okay.
Thank you,
So
Doctor.
let's summarize this. We'll look at the population excluded. That can turn to research question. We look at the age of inclusion or in the trials. That can also be a research question. And then we look for, in some of the trials, they also have future directions and gaps in knowledge, right? That's also a way to find research questions.
Thank you so much, Dr. Endurance. This is like the tip of the iceberg in the whole thing. This is just to show everybody what we do behind the scene when we're doing these studies. And we're trying to make it as simple and as engaging as possible. So we'll stop here for today. We've done over an hour plus. We go into question open mic. The entire series is going to be long, and we're going to be doing this every Sunday until we get you to where you can be very independent. We've just taught a little fragment of it, little introduction of what is research, little introduction of types of research, and then where some people have said this is where the problem is, identifying a research topic. And Dr. Endurance has done extensive review on one of the ways to identify research topic, because there's so many other ways that he's going to talk about, and so many other things that we're going to talk about as days unfold. If you have any question within this frame that we've discussed, what is the research, types of research, what falls into what they call a research, and how to identify a research topic and where to start from, please open your mic and ask. If you have other questions that fall outside that frame, you can also ask. We'll see if we're going to take the question today or we're going to keep it for our subsequent sessions that are coming. But we want to be as precise as possible so that this series can flow. So we don't jump to Z and leave A. I just want to be as thorough. So anytime you pick up this video and you watch it, you could tell yourself, now I know how to get a topic. The next thing is, how do I start writing? And go on and on and on. Questions, Dr. Ibrahim?
Yes.
You could stop sharing so that we can return to. Go ahead.
Stop share. Yeah, I've stopped share. So thank you so much, Dr. Edward and Dr. Endurance, for putting up this enlightening session. I have three questions. Two of the three of them, like one or two of them are within the scope of today's discussion, and the third one, I'm suspecting that maybe that's the one Dr. Endurance was going to next, but because he don't want to overload us today, so that's why I just stopped there. So the first one is, what's the most efficient way to use AI to generate research topic based on today's current realities and the integration of AI into research? My second question is, if I have an idea of a topic that I want to do a publication on, let's say maybe literature review, like a comprehensive review or something, what will I see to say, oh, this topic, I don't think I should go forward with it so that I don't labor in vain. What exactly should I look for? Is it that when I put that topic on Google search and then maybe I see like about 5 or 10 publications on the same topic, then I should stop? Or when I just see 1 or 2, where is that line that I should not cross? You were saying something like, oh, okay, we can see that this topic, not much work has been done on it. When do I know that, okay, much work has been done on this topic or not much work has been done? That's my question number 2. My question number 3 is, okay, so when I have a topic, then I now know that, okay, this topic looks like something I should proceed on. What's the most efficient and effective way to know the exact number of references I need to use and which ones in particular? You understand? Like, okay, this, for example, this topic now or something related, I say, okay, the prevalence of
Right.
depression, the prevalence of psychiatric disorders post-MI. So what are those papers that I should include, and when do I determine the number that I want to use? That, okay, it's 20 references that I should use, it's 25 references I should use. So I'm still trying to master those areas. So that's why I'm asking questions and to learn more about them.
So let me take the third one. It's very easy, and then the second one is also very easy. Ignorance can tackle any of them, or maybe echo what I said, or take one. The number of references are principally determined by you. That's number one. You, when you're making your statements, you're getting your source from somewhere. That where you're getting that idea, because you did not create the statement, becomes a reference. So for each categorical statement you make becomes a reference. For example, people die from cardiovascular mortality, from cardiovascular diseases. Heart failure kills people. That's a categorical statement. You're not suggesting. How do you know someone has done the research before? So you saw it somewhere in that paper, that becomes a reference. The next statement you're going to make like that, you keep adding your references. However, while you are starting research, one thing that we do as researchers is also have in mind, what paper are we going to publish in? So we're projecting. What are these papers, the publishers, the editors, what is their rule? Some papers will accept between less than 16. Some papers will say 25. Some papers will leave it open-ended. Some papers will say 60 and above and the rest. So you have to have that in mind longitudinally. Okay, I'm going to submit in Lancet journal. You have to look at Lancet journal rules of publication. If you go to the Lancet journal, they're going to say for edit, you're going to see for authors, and you read it. So for many of the journals that were submitted, we've already read their ways, we've understood how they accept papers, and then we stick there. You'll see how the journal wants you to write it, what reference, what citation style, what type of, whether you're using Calibri or you're using New Times Roman, what size, the nuances and the technicalities will be there. Whether you're using AMA reference style or that. You also may not use that style. You can just write and then eventually convert it to theirs. There are some generally accepted statements that you're going to make in research that you don't need to reference, right? Those are generally accepted statements. For example, if you say one of the diseases in cardiovascular system is hypertension, that's a generally accepted statement. You don't need to reference that statement because everybody knows that one of the disease categories in the cardiovascular system is hypertension, or one of the major depressive disorders is major depression. That's a general statement. You don't need to put that. But if you're making another categoristic or categorical statement about major depression, you have to reference it. So your references keep adding on, and that's sometimes when we're writing at the end of the, when I'm done in the morning, I would have had like 60 references. I'll now begin to comb them down and reduce them, right? That's one way. Number two is, what type of research are you doing? Are you doing a case report? We determine what type of reference. For case report, 5, 6 references, 7 to 10 is okay. Are you doing a literature review? you could decide on your own to say, I want to review 25 literatures only. That's it. You're not going beyond that. That becomes your citation. That's you deciding. As long as, if you are hoping to publish it, does it tally with the papers, the journals, recommendation and guideline? If you're doing a systematic paper, then you cannot decide the number of references that you're going to include, because in a systematic review, your major focus is to use systems, checkpoints to get to the papers. Checkpoints for inclusion criteria, checkpoints for exclusion criteria, checkpoint for are they written in English, checkpoint for are they clinical trials or randomized trials or retrospective or case reports, checkpoint do they have p-values, checkpoint are they heterogeneous or not, checkpoint. By the time you keep doing this using what they call the Prisma flow or the inclusion and exclusion criteria or the system, whatever system that you adopt, you find out at the end of the day, I'm going to review only papers on PubMed, I'm going to review papers in PubMed and this and that and that. At the end of the day, with using your system, you're going to come down to a defined amount of paper. The reason why systematic review is highly regarded is that if another person replicates that system exactly the way you did it, it's going to arrive to that amount number of papers without playing the system. That is where systematic review is. If you're doing a prospective study, so like we're just talking about what happens to the fat cells, do they shrink out or do they stay or do they dissolve, whatever it is, then you now begin to fish for what references I'm going to use to support all my literatures that I'm doing, especially in the discussion area. And then you arrive at a number of references. Remember that when your references, it has to also be an in-text citation. An in-text citation is those numbers or John et al., depending on what site, hypertext is different from reference. We're going to talk about that in another session. I don't know if I answered that question. It's a long response, but I needed to be very thorough so that we don't run across it again. In the future, when somebody asks a question, what's the number of reference, we'll refer them to this video that we're going to use. Dr. Nderas, I'll take the first question. The role of AI.
Thank you very much. So like you rightly said, for the reference, let me just add to what Dr. Ed had said. For the reference, it's always good to, it depends, the case reports, but always try to find out what journal you are going to submit and use that as a guide. I have been in the unfortunate shoe that I had like 150 references, and then I found out that the journal only took 50. So, but now, according to your question had two parts, and the first part was, how do you know which reference to use? What you want to do is, when you are searching, we're going to talk about that specifically, search engines and how to search and generate your references. We'll talk about that. But when you decide which reference you're going to use, you cannot use, in some cases, you can't use everything. In the event where you have to choose, always choose the journals that had a more thorough methodology. They were published in a more higher impact journal. Those studies have more rigorosity to them, so they are more likely to be done well. So that's like a way you want to gauge it. Now, it's not always true, but it's something. So, for example, if it was published in the New England Journal of Medicine, or was published in Lancet, or published in JAMA, I don't know about psychiatry. I don't know what the top journal is in psychiatry, but they're like top 5, top 6, top 10. You kind of lean towards those references and select them. And another thing you want to do is use the studies that were very comprehensive. So some studies will talk about 3 things at the same time. Instead of using 3 different studies to talk about those 3 things, use one study that talked about the 3 things as a whole. But it's a whole lecture for that. We will talk about that in another.
Right.
Just generally pick the ones that have better methodology. So that's to that question about the AI. How do you use AI to improve research question? So you see the whole gymnastics that we did just now. We went to state-of-the-art review, and then from there we found future directions, and then from there we went to Google Scholar, we went to PubMed, and then we found out, is this been published? Is this not been published? And then now that it's not been published, we're now going to start asking the question. You may just ask Google Scholar straight up. You may just ask, I have a question about, so you could ask AI or ChatGPT. The problem with AI and ChatGPT is that you will have to double check their reply because they have a lot of inaccuracies. So ChatGPT, Grok, and I think there's open evidence. They also can hallucinate. So at the end of the day, you still have to double check to make sure that what they have said is in keeping with what's in the literature. So I don't think it takes you as much time. You could ask ChatGPT, what do you think? I have a question on depression and microinfarction. What areas do you think will be novel to explore research question? And then they might generate some questions for you. But at the end of the day, you still have to take those questions that they've generated and find out if it's been done, yes or no. So you could circumvent a step or two to just go to potential questions that you may now verify on PubMed, on Google Scholar. But, I have my own bias because, AI in itself is not at that point where we want to solely rely on them. So I would encourage everybody to do that logical thinking, because just going to those state-of-the-art review, going to those trials by yourself, there are so many things that you will stumble upon that you could never have, thought about if you didn't go there. Like, for example, when we opened that trial in China, the eye care trial, we just, off the bat, we saw that this trial was done, but it was done in China. So now we already have a question in addition to what brought us here. So I would encourage everybody to try and just do it, because it doesn't take much. Just do it the way, it's pretty straightforward.
I will add to what Endurance said, encouraging everyone to do it pretty straightforward. I know we're in the age of technology. Probably in the next 20 years, we won't even be having this meeting because an AI will be having a meeting for us. So life is moving so fast, and things are advancing. But as a beginner, as a newbie in research, which many of us are, or many of you are, I wouldn't call me and Endurance newbies in research anymore. Understand the nuances, the nitty-gritty, how to do these things traditionally before you jump into AIs. That has been my biggest stand. Understand how to do it traditionally first. Then there are tons of AIs that I can subscribe to. I don't want to mention their name and I have a list of all of them that I use sometimes comprehensively. So I just plug in my idea, it tells me all the things, maps it for me. You generate whatever content you want to generate, right? They're also prone to error, like Endurance said. But these classes are not first for that advanced level. Let's teach people, handhold people into the nuances, and then we'll go from there. Your second question quickly before we close is, and then somebody raises his hand, Buki. Your second question quickly before we close is,
how do you know if your question is worth it? I think that will be by the time we're trying to, so now we have an idea that this study is relatively not done. How do you know it's worth it? If you have very well done studies that have been done recently, something that was done with a very comprehensive methodology, and it was very recent, like less than 5 years, there is no need to pursue to do it further. Now, you could argue that, we can still redo it. This doesn't matter. But the idea is, if you have something that is relatively novel or new, the journals will be accepting very quickly. And by the way, there's so many questions you can ask, so there's no need to spend so much time doing stuff that someone else has answered, right? So if you've seen that this has been tackled really, really rigorously, with a very, very comprehensive analysis that you could not outdo, then there's no point. You could just pivot and find an area. There's always an area that has not been explored. Always. People think that research questions are like limited. Nah, it's not true. There's 1,000 research questions that we could never answer in our lifetime. So just find another thing that's relatively underexplored. The more underexplored it is, the more you are going to get accepted and get invited to talk about it.
Right. But there's an aspect of this conversation that I really want to pitch in. What Andrea said is, remember that I know that many of us have this publish or perish mentality, which, unfortunately, that's where we are. You needed to add to your resume. You needed to climb to for your PhD. You needed to get your master's. People are looking for EB2 and all those whole different stuffs that you want to do. But primarily, the objective of research is actually to find knowledge and to solve a problem. And you never can tell if you can solve a problem without starting, right? Sometimes you could foretell, other times you could foretell. That's why I usually tell people in our academy, my students, that research has 2 outcomes or 3 outcomes: positive finding, negative finding, and I couldn't complete it. And that will bring us to the end of today's conversation after Betty's. The positive finding, we published. The negative finding, you can also publish it. There was no relationship. I couldn't find anything. And I was telling somebody today, our conclusion is that there was no consensus to what consensus that exists. There's no consensus to the consensus that is already consensized or whatever it is, right? And the one that you cannot now publish is you did not complete it, but at least you would have gained knowledge. For those in this forum trying to apply for fellowship, residency, or what, these are the classes that we want you to attend, so that when you're talking in an interview, you could be able to say, I searched, I conceptualized, I looked at this, what did you do? I had these meetings with this particular meeting, for example, it's something that you could say, we attended a meeting where we were figuring out what idea we could publish, for example, like this meeting, and eventually came down to depression in this. That could only be your role. And then another team, did this, another one did this, another one did this, and eventually we published this idea. So to everyone, we encourage you to invite your friends. Dr. Buki, I don't know if you have your final question, because it's 99909. We've gone way behind. Final question, one thought. If you don't have, we'll be calling it today. I saw your hands up. Yes, you can unmute and then ask a question.
Okay, thank you very much, Dr. Endurance and Dr. Edward. My question is a follow-up to what you were saying concerning when we want to look at the randomized clinical trial, which is like a primary research. You said to look at the criteria that were excluded. So for the example we used, we saw the people with depression, schizophrenia, they were excluded from that study. So if I were to be interested in studying, like the risk of cardiovascular disease in such population, and many of this randomized clinical trial have already excluded them. So where will I find my source from? Which paper will I now use to do my review?
So it also depends on, do you want to do a randomized trial?
No, to do a literature.
Because if you want to do a randomized trial, then you're trying to include them in your randomized trial. That solves that problem, number one. If you want to do a literature review, and Endurance can also answer this. If you want to do a literature review on the role of cardiovascular or the effect of heart failure in depression, for example, that paper has excluded. That paper has excluded it. Okay. Did other paper exclude them? Remember that there are tons of paper. If you go to PubMed, you're going to see 700 million, I'm exaggerating, 300 million, I'm exaggerating, whatever, but it runs in millions. So that's where we're not going to teach the next technique, using the advanced system to put the keywords and see, okay, well, John et al. Excluded. these other people included. And you use that, and then you figure out that these people, and they are not only PubMed, there's so many other databases, Embase, Google Scholar, Cochrane Review. I can mention like 10. When we have the database, we've shared it here. It's in our media section in our group. If you're in our group, go to our media section. You're going to see the database to look for citations. Dr. Endurance, if you have one or two things to Isaac.
Yeah, I think that question is a good question. So they were excluded. How do we find them and how do we do them? It's two things. It's possible that they've been done, but not in trials. And it's also, so like retrospective studies or registries, but it's also possible that they've not been done. What you will do is when you write about them, even if you can't find anything that's been done about them, you will now compare your findings to the findings in people without schizophrenia. So you will be referencing studies that did this intervention in people without schizophrenia, for example. Do you get what I'm trying to say? So you will say, we found that people with schizophrenia had normal blood pressure and did not have increased mortality in cardiovascular events. This was contrary to the findings in the ICARE trial, where they found that psychiatric patients that are in bracket non-schizophrenic patients had increased mortality, increased hospitalization. I don't know if you understand. So we're still going to have to reference somebody. But now, because we don't have anything that's been done, let's say it's not been done at all, we will now reference and compare the population that was initially done. And it makes sense because we are trying to study this population, but we don't have data on them. So we have to piggyback on the existing literature, right?
But
Thank you so much. Yeah, go ahead.
My question now is that you said we would have to piggyback on what those other existing literature is saying. But what would be my own? Do I have to now be involved in a primary research by going to a clinic to take a data from patients that have depression or schizophrenia to now use it to compare with the ones that have been excluded? Does that mean I have to do a primary research now?
So let me take this question. Okay. Let me answer this question. So yes, you're not going to compare your results to them in per se. You're going to not your result, your findings. So you can do it in two ways. You can collect data in your institution, or you can find publicly available data. And this is a whole topic for another whole series. I'm going to talk about how we collect data in our institution, because most people, they kind of think that that's a big deal. It's not actually. It's pretty straightforward. Collecting data in your institution versus getting data that is publicly available, which is faster actually. Now you use that population in your institution and you do your analysis within your population, then you have a finding. If you don't find any other person to corroborate your story, let's say there's nobody who has published in that area, what you will do is you will report your results, and in your results, you would compare your results with what was found in normal people without schizophrenia, because you don't have data. That's what you would do.
In echoing what he said, if you set out to do a literature review and you don't have data and literature, that means you can't do the literature review. Or what literature review, that will now redirect you to do a secondary study using what he has just explained. You now look for, okay, I am so interested in this topic. What is happening to people with depression? So let's look at national data. You now analyze the national data. Or, oh, I saw this lady with depression. Let's look at this lady. Case reports. What happened to her ejection fraction? What happened to her cardiovascular outcome? You redirect it to case reports, right? So it will now, because you don't have the data you're not going to review zero paper because you searched. That's if you truly searched the 10 databases that exist. If there are 10 databases or 20 databases that exist, and you could not find people that talked about that outcome in depression, say, there's no data in this. All right, let me do a primary data. And that will now form the basis for most of your introduction to the journal, to the people. that, wow, we looked, we couldn't find data. That necessitated this study. So it becomes one of your objectives, either your secondary objective or your primary objective in that study. Having answered that primary objective, secondary objective, Dr. Endurance, I'm so grateful for having you today. Dr. Ibrahim, thank you for volunteering to share your screen. Keep in touch with us for those who have chatted me privately behind the scene and those who are chatting Endurance and other people behind the scene. Keep in touch with us, join our group. We share unlimited knowledge on how you can become successful in a research sphere. There's another area of research that we're going to talk about, how you can actually make money from research. A lot of jobs that we're going to start talking about that are open to people who have research knowledge: clinical research coordinator, clinical research associate, principal investigator, principal scientist, research study coordinator, research scientist, pharmacovigilance, pharmacotrial manager, trial managers, research writers, grant writers. These are jobs that pay in 6 figures, and those jobs are things that you could do part-time at home, sitting out, for many of them, sitting at home and earning your funds if you have the time. Our focus is to be able to train you organically to get to where you should be independently. My name is Dr. Kobe. I also thank myself for the session, and have a wonderful day.